exactly the supraspinous ligament, okay? Now between them we have an opening which is going down towards, this is the lesser sciatic foramen, okay? Was it clear? Okay. Here we have the greater sciatic foramen, probably you remember, which was divided into two parts by a muscle. This was the piriformis muscle. Here is the infrapiriform hiatus, that's the suprapiriform hiatus. You should revise it that here in the infrapiriform hiatus we have the sciatic nerve, the posterior cutaneous nerve of the thigh, the inferior gluteal artery vein nerve, and here, and now it's needed to show, here we have the pudendal structure, the internal pudendal artery vein, and the pudendal nerve, no internal. Okay? They are passing through the sciatic foramen, okay? And then they go back towards the perineum. Okay, we will talk about what could be the reason. They use a canal in the okay, in the wall. That's called the pudendal canal, or with other names called the alcox canal. Alcox canal is needed, okay, in order to reach the structures here. Between this region and between a muscle, which we will study today, we have a big area which is filled out only by fat. Nothing more, just fat. And tiny perianal branches up. This area, can you see here? This is the ischiorectal fossa. It contains mostly fat, 90%. Just fat, okay? It will be important. Now, what other ligaments do we know? The own ligaments. Of course, here we can find some tiny ligaments between the sacrum and the iliac bone. And what are these ligaments? Sacroiliac ligaments. We have dorsal ones which are visible here. I know it looks like nothing, but can you see it's very strong membrane-like structures? We are not able to see separate little ligaments. We are able to see the membrane-like structure, or sometimes lines on it. These are the posterior sacroiliac ligaments. But of course, if I turn it, inside between the sacrum and the ilium, we also have the anterior sacroiliac ligaments. Okay. Plus, we also have some ligaments from the last lumbar vertebra towards the ilium. These are muscles here, but in the deep here we looked at some tiny ligaments. These are the iliolumbar ligaments. Okay, that's what I can see here, and I can show these structures. The last structure, which is a kind of ligament, but it's a membrane actually, will be inside. Can you see where is the obturator? Not really, because it's covered. Of course, inside we have a muscle which covers it, but right below it we have the obturator membrane. Okay, and of course we have a strong structure which covers it. Only one tiny foramen can be seen here, which is passing through. Okay, that's the obturator canal, where we can find the obturator nerve, which we discussed last time, and we can find the obturator artery and vein. Obturator artery will be the branch of the internal iliac artery, which we will dissect very soon. Okay, and obturator vein, of course, drains back into the internal iliac vein, and common iliac vein is very available. Okay, so these are the structures which are ligaments, and we have to understand that. These ligaments mostly responsible for holding the complete hip bone and the joints and this region together. Okay? No more function except the obturator membrane, which closes the door towards the obturator foramen, and it makes it strong not to let anything pass through here. Okay? Now the second question which we have to discuss today, can you pass somewhere in the pelvis towards to the outer world?
Yes.
What are these? Three structures can pass through. What are these three structures?
Rectum.
In male and female, rectum.
Bladder. Urethra.
Male and female, urethra.
Vagina.
No. And the vagina in female, that's the third one. Nothing more. Not even one tiny vessel. Okay? Nothing can pass through here. Was it clear? So now you should understand, if everything is closed towards inferiorly, nothing can pass through here, how can I lead the vessels towards to the genitals. Okay? How can I do that? Only here. The pudendal artery and vein and the pudendal nerve will go towards here. We will talk about what is this. This is going to be the urogenital diaphragm. Until it, and then it splits into two branches. The deep one, which supplies the deep part of the genitals and the perineum, and the superficial one, which supplies the superficial structures. But as you see, they supply everything here. Nothing can pass through here. What about the obturator? Is it supplying something related to the genitals? No, it goes to the thigh. So can you see if something is in the pelvis or out of the pelvis, we need the blood supply from here. Okay, so that's why we need this bypass. Some of the books will say that this is the only nerve or vein, artery, which coming out of the pelvis and then goes back to the pelvis. No, I know that there are some books. That's the only one which coming out of the pelvis and goes back to the perineum. Perineum is not in the pelvis. Okay, so anatomically is out of the pelvis, but this is the perineum which contains the genitals. That's why the other book says, okay, it goes back to the pelvis because it supplies the genitals. No, these genitals, it's out of the pelvis. Okay? Was it clear? Okay? Now, what is the structure which can close the way towards entry? Okay? We can find two big diaphragm-like structures. Okay? Two big fascia system and muscle system. The first one is an infundibulum shape, something. So what if you remember when I started to show that everything is closed, I said like this. Just imagine you put an infundibule into the pelvis and the lateral wall is made by muscles and the tip of this structure will be the anus itself. Okay? Everything on the sides made of fascia and muscles. This is called pelvic diaphragm. Okay? Pelvic diaphragm is not so simple. Okay? It's a quite difficult thing to show the structures only on this model. That's why Zoe came in the beginning, because she said that they have a very bad one. It's not really better than theirs. But in this you can show something. Okay? Not everything, but some of the structures. This topic is not a good topic because half pelvis, plastinated pelvis, ligamentous pelvis can be used for identifying the structures. Okay, this is called ligamentous pelvis. This is not fixed. Okay, this was made when I removed it from the cadaver. We didn't even fix the cadaver. We just started to cure it with glycerine until 1.5 years. Actually, we mummificated the person. This is plastinated. It means it was a real human. It was fixed. But then we pushed silicone instead of water into the deep, so it became plastic. Okay? Halved pelvis. We do not have it now, but in the next practice we will have. Okay, it is a vat specimen. Okay, normal dissection, just you can rotate the things. The problem with this, with the mummification process, everything dries out and it's very breakable and it's very hard to find the structure. This one is beautiful, but unfortunately I can not really lift up the structures and see behind it because it becomes hard. The wet specimen will be the best one, but unfortunately the wet one is usually destroyed by the students. So please do not destroy it because you make your job harder. Okay? Try to be very careful. Now let's see this portion, okay? Let's focus on that. The pelvic diaphragm is mostly formed by a fascia, which can be found externally and internally. How do you call these fascias? Any idea? Difficult thing. External and internal pelvic fascia, and between them we have a muscle. This is the levator animus. Okay? The levator animus has a lot of soft muscles. Okay? And let's see the origination. First of all, the levator animus muscle from some kind of can you see those branches?
Yes.
Okay?
Very small.
Very small, and they're going towards there, and then you won't see anything. Okay? So somewhere here, you see that level of the pubic symphysis. Can you see that? Something is arising, but then I cannot follow it. It does disappear. Yeah, one time. It's like this. And here, I see it's going somewhere there. Here I see again it's coming there, but I cannot fully. Yes. So if you look here, this is the pubic symphysis. Here, something is going, but then I disappear. I cannot continue here. It was originating somewhere there. Okay, that's the first part of the clavicle. This is called the pubis, because it comes from the pubic bone. We go rectal part. So actually, that's why I was not able to follow it, because it disappears on the side of the rectum. Actually, it makes a loop around the rectum, okay, and pulls it anteriorly. Okay, that's why we have it. Oh, that one, it's beautiful. That's why we have a tiny little raking in the last part of the rectum, in the anal canal. We call it angle. This is called the puborectal angle because of this muscle. That's the first part of the levator artery. Okay, but can you see between the rectum and between the pubic symphysis? Do we have something? No, it looks empty. Okay, it's like two muscle fiber, and between them nothing. Okay, because we will have another diaphragm which will close this way, but the pelvic diaphragm doesn't have closing points and entry. Okay, now we have only one part. Okay, that was the puborectal. Of course. Okay, so can you see it was the pubic symphysis here, and there are some muscles here which are coming, and then I cannot find it. Okay, because it's so between the other muscles. Okay, but between the rectum and between the coccyx, so that was the anal, okay, the anus. And you see here, between the sacrum and coccyx, here we have again, looks like a muscle. Can you see it? Now it's sometimes muscle, sometimes ligament. Depends on the cadaver. If it contains muscular fiber, of course we call it anacoccygeal muscle. If it contains only ligamentous fibers, we call it anacoccygeal ligament. Okay, if it's strong, it's usually a ligament. Okay, in female, mostly tiny muscles. In male, 50-50 ligament or muscle. I don't know exactly what is the reason why the muscles are disappearing here. Okay, was it clear? So it's not so difficult. Now we know the puborectal part and the anacoccygeal part. Okay? Was it clear? Yes?
It always starts as a muscle and then becomes a ligament?
It's supposed to be a muscle. Evolutionary, it's a muscle. But I don't know why it turns to be a muscle. Probably we don't need it.
At which stage?
I have no idea. No developmental answer for this one, unfortunately. Okay, and look at the photo. Oh, look at the photo now. So now we're talking about the green part. I mean, can you see that green portion which is labeled? Now, how do you call it? Oh, it's the diaphragm. What is that? That's why I'm asking. Pubococcygeal part. Iliococcygeal part. Okay, so can you see from the ilium, there are some muscles which are going towards the coccyx. It's part of the levator arm. Can I see it really? How can I show it if I see it? Because usually the students look for this figure in the cadaver. So, unfortunately, this is true. The students are trying to look for this. Yeah, where? Yeah, that's the problem. Everything looks like a map. But why not here? This part, actually it has a hole in it. This is an artificial hole. But it's supposed to be a muscle here that makes it infundibly shaped lateral wall. Iliococcygeal part, there's this one. It's nicely visible. It comes from the ilium, goes towards the coccyx and traffic. Okay, so this portion is called the iliococcygeal part. Now if you imagine this one, I put my finger on the side. See, so if my finger appears, it was somewhere here. Okay? It was going here. So that's what you should see from inside. Okay? Okay, Rome, I think this was the wall itself. Okay, so it's easy to show if you can imagine that. Can you see it? Was the wall, yes? Yeah, it would be like something like that. Question, where does it originate? Yes, that's what I showed you. Which I'm going towards this portion. Okay? Where does it originate? That's the distal attachment inside there. But where does it originate? We have a ligamentous arch, a tendinous arch in the pelvis. Okay, the tendinous arch of the pelvis, where you can see the green on the side. Okay? That's the origination. Look here. It is possible to see. Can you see this is a membrane? On the obturator membrane, here we have a line-like structure here. That's the origination of the iliopropsychus. So from here, it goes down to here. Okay. I know, it's mostly imagination. Here you see the line. That's the muscle itself. That's the tendinous arch. Okay? Tendinous arch of the pelvis. Okay? I will do. And you see here is the obturator structure, okay? Below it, I see a tendon-like tiny line which is going here. And the muscles, can you see? Even you see the orientation of the muscles. This is the iliopropsychus.
That's that
Yeah.
one. It's that one. Yes.
Okay. So first, you have to identify this obturator structures, okay? But below it, oh my gosh, I have to set up. Here, I can find a tiny, something like that one. I don't know what I'm showing. Okay, and it's going down. Okay? Yes, Mariana? No, it is the line what I showed. That's the tendinous arch, which looks like nothing more than the line on a patient.
It's below the obturator muscles.
Is it this one?
It's below the obturator
It is on the surface of the obturator membrane. Actually, what the book says, that's the strengthening of the obturator membrane in one line where this muscle goes. Yeah, that white one.
The white one. I think
Yeah,
I saw
that's
something.
Say that it's
This side is better.
obturator membrane.
Yeah.
Yeah, you can see a line. The other one is like.
I don't know which one. See this white line, which is going down, and these ones will fight it.
And then when pelvis, then this
That's the
straight to
left.
pelvis. And then it is related to.
Okay?
Yeah.
Both sides like that. They form the infundibulum shape hole. Okay? Now, do we have another muscle? The blue one. What is the blue one? The coccygeal muscle. It's not part of the levatorali according to some books. It's a separate muscle. Some of the teachers here say they again part of the levatorali system. I don't know. Okay, but the coccygeus. Now the coccygeus muscle. Yeah. Believe it or not. Yep, that mess. Okay? Yeah.
How much did you pay? How much did you pay? Tell us.
Yeah.
I told you in the beginning to come sit here.
Okay, it looks like a mass.
The ticket costs.
No,
Because we see
yes.
instead of money.
I'll sell my kidney.
To sell your kidney is crazy. If you have a washing kidney, you can cut it in half and sell the one.
Believer, yes.
That's why you want to look at it. You have right, you should.
On the left, because it's a washing.
Okay?
Are you sure?
Yes, I do.
Because it's separate.
Okay, here was the iliococcygeal, but look here in this mass. Actually, here I see some fibers.
Just
Yeah, you need to. What are these ones? Those are here and literally cannot bear.
These ones right here. Yes, these ones.
That's why I said I show, but
Test for the rectal.
yes.
What like
No, it's not rectal test.
Prostate.
prostate?
Prostate. Yes.
Prostate test. You would
Forward.
be- Oh, I forgot to ask something. Before we continue, because we finished the Lavatroni actually, we finished the diaphragm. I don't know why. It's a very, very frequent question on the final exam. Whether it's a male or a female pelvis. What happened? Student starts to measure. Ilia, Allah, I don't know.
Male,
Male.
female.
Nice. Okay? Okay. Just don't do that, please.
Answer to
Like,
your question.
oh, this is wide, the angle is big, and oh, it's probably, it's a female. No, guys, penis, male. Okay?
You got your answer?
90% of the cases, I
You
believe,
got your answer?
they don't even care what is here. Just they start to focus on and all these things, and they don't know what are they doing. And you know, when you say that this is a female,
No chance.
no, it's not a problem for us. It's short day for us. Okay, now, okay, was it clear? Now just imagine what we have studied. Puborectal, iliococcygeal, coccygeal part forms here an infundibulum, which is a bit open anteriorly. Okay, the tip of this infundibulum will be converted into the anus. In the anus, actually in the last part of the lavata here, we can find a thickening. What is this thickening? We have a sphincter, the external anal sphincter, okay, which is striated muscle. Okay, so that's why we can look for it. Was it clear? What I said anteriorly, it's weaker. Okay? Here's why is it important for you
What?
that the lavaterani anteriorly is a bit weaker for giving birth. But just a minute and we will talk about it. Okay? Just first we have to understand something else. Okay, was it clear? That was the pelvic diaphragm. In the handout, a lot of other picture can be seen at what can be found above the diaphragm. What are the organs we have located here? Of course in male, I don't have a half pelvis now, I would need it. We have a rectum, actually the anal canal, and the ampulla of the rectum is located here. And everything is infraperitoneal position. And of course then in male we have the bladder, okay, the urinary bladder, which is also in infraperitoneal position. Only the vertex and the body of the bladder is covered by peritoneum, okay? Do we have something else in the male pelvis which is communicating with the peritoneum and we is considered as an infraperitoneal organ in the pelvis? That's why I'm asking, because usually this is the answer. And usually this is mean that I have a short A. Because the prostate is below the bladder. Okay, so it cannot be infraperitoneal, it's out of peritoneal. It's in the pelvis. Testis is not even inside. So nothing more, only these two things. The prostate is below the bladder, the seminal vesicle is below the bladder. Okay, so we do not have any connection with the peritoneum. In female, hopefully you understood this is female. Okay? Again, let's see. Here we have the rectum. Of course, first part is intraperitoneal, and we have an infraperitoneal portion here. Then we have something else. This is the, now you see something which is not in our cadaver. That's the uterus. Okay? That one. If I tilt it, it's closed. Up. Okay, that's the uterus. The uterus superiorly, it's covered by peritoneum. The body of the uterus, the fundus of the uterus is completely covered, and the peritoneum just makes a reflection points at the level of the cervix. Cervix is in the vagina, and it's not covered by peritoneum. That's why the uterus is considered as an infraperitoneal organ according to the anatomical nomenclature. Gynecological is there. Okay? Was it clear? here. Then we have the bladder. Okay? That's the bladder. And as you see in this dissection, means half the, and here she left the peritoneum here. Here he removed it. Okay, so it's nicely visible that it's in intraperitoneal.
The thing about it, like the open.
That's the bladder. That's the uterus.
It's big.
The bladder.
Yeah.
So uterus.
Yeah.
Okay, just now what do we know about the? Yeah, sure.
You see, like,
Do we see the lower anterior?
the white thing that we're
But it says lower anterior.
Anterior it's almost below the bladder.
It's not breaking.
That's the bladder.
I would see the baby.
That's the uterus. Okay.
This is
No.
child like a teenager.
No, it wasn't. It's a really old woman.
A really old woman?
Yeah. But she was really healthy when she died. She died in heart attack. No problem with anything else. Unfortunately, she was, if I remember well, more than 90. She was really, really old.
Is this relatively?
Should preserve her.
Yeah. It's okay. Everything is perfect. Anatomical size and position.
This is even a bring a beam to see if we can fit through the shoulders.
Yes, I will do. With the mother.
Yes. Okay. Yeah.
So,
I mean,
Okay.
the baby will be in the uterus of the mother. You will see the vagina, all these things, and the baby is in the 8 months.
so we had the lecture about the anal canal and everything, and specifically about hemorrhoids. And I wanted to know where the two nerves depart, two types of nerves.
Here. This is
Yeah,
the hemorrhoid.
sphincter.
Yeah.
Okay. So
Okay.
above here it's just normal, and then here you start to feel the pain.
Yes, exactly.
Okay.
Okay? Now, what, wait, something. Okay, so let's talk about still the uterus. Okay? The uterus, that's why you asked, who asked me? I'm sure you asked me about that. Above or below, I don't know. The uterus cervix is located behind the bladder, but the uterus body is reflecting towards the bladder. Okay, it lies on the surface. Looks, that's normal. It should lie on it. In the vesicouterine excavation, we have an angle between the uterus parts. We will study that one. What is that? This is called the anteflexion of the uterus. Okay, it should lie on the surface of the bladder. Just imagine if the mothers, they have a baby, they usually go to the toilet very, very frequently because the baby just pushes something here at the moment. Oh, it's a bladder. Let's go to pee. Okay, so it's something like that. It is always below it, but actually it is anterior. Remember, the bladder is anterior.
Is it because the pelvis is inclined?
Yeah. Okay. Was it clear?
The fallopian tubes, they would be going posterior. So this is the uterus.
That's the fallopian tube. That's the ovary. That's the ovary. That's the fallopian tube. Okay.
So they just have that.
Okay, so no, you don't need it. Not today. I promise we will study that one. Okay. Just I need another specimen. Just today, focus on the positions. Okay, nothing more. So when we finish this one, I mean the inner structures. Now let's see that something should close the way towards to the internal genitals of female or male. Okay. We have a good new diaphragm, which is located somewhere here. Or I think it's better to use another specimen. So can you see? That was a female. Here is the pubic angle. And just imagine here we have a trapezoid shaped area. Okay, which is closed. That will be the urogenital diaphragm. Okay? Urogenital diaphragm again, fascia, muscle, fascia. Okay? Which means external fascia and deep transverse perineus muscle and internal urogenital fascia. Some of the books do not even see that we have muscle there. In the handout, we show nice figures that we have the deep transverse perineal muscle. But actually, in real life, if you want to operate this part, you won't see the muscle. These are mostly muscle fibers which is mixing with the membrane-like structures. Anatomically, membrane, muscle, membrane, but real, it's very hard to differentiate between them. Okay? Now, in male, only one opening. In female, two. In male and female, we have the urethra which is passing through. But around the passing of the urethra, we have a circular shaped muscular strengthening, which is called the internal or external. Which one? External sphincter of the urethra. Okay? It's very strong. Now, in female, right behind the opening of the urethra, we can find the opening for the vagina. Does it have any sphincter-like structure? It's weaker. It's only the membrane which borders it. Okay? Now let's see on this, and then I will ask a lot of questions. So if you agree that this was the trapezoid shape, can you see this portion? What I'm holding now? I know that you are gone. Those who are there, turning, looks like an edge. And you see, I can even push my forceps and I hold it. That's the urogenital diaphragm, and that was the posterior edge of it. On the posterior edge, if it's possible, you are able to see a very tiny muscle, that one. That was the transverse perineal superficial. Okay, that's the superficial transverse perineal muscle which is located here. Okay, so if somebody asks it, just show to the edge here. Okay, and that's the diaphragm.
During finals, we always take the plus one.
No, this one, this died out. Here, that's the diaphragm, and here is the transverse, superficial transverse perineal muscle. Okay? Now, let's talk about the diaphragm upper part. Because I said it's a trapezoid shape something. But this one is an angular shape. So we should have a tiny space here. But it's closed by a very strong ligamentous system. And some tiny vessels are passing through here. This is called here the subpubic hiatus. Okay? And the deep vessels for the penis or for the clitoris are passing through here, not from inside, from outside. Okay? Was it clear? Now it's closed. Nothing can pass through here. Only the two in female and one in male. Okay? What I said, posteriorly, close to the anus. Okay? This is the termination of the urogenital diaphragm. I tried to show it here. And between them, here, we have a strengthening when the two membranes meeting. They form a tendon-like structure. This is called the central tendon. This is hard, okay? You can palpate it out in male and in female, okay? That's the only strong structure in the women which will separate the anus and the vagina, okay? Now why did I say all of these things? Baby delivery, okay? Okay, first, let's start in the beginning. What is the normal diameter of the vagina? Without anything, it's normal. You sit here, what is the diameter of the vagina? It's about 1 centimeter, okay? About 0.5 centimeters to 1 centimeter. So it's not a big one, okay? Is it clear? Is it normally? It's okay in the time. What happens in case of sexual life? What is the diameter of the vagina? More. Good answer from a shy guy. Let's see. What is 2 to 3?
7, 4, 5.
Depends on the husband, but mostly about 3, 4, or 5 centimeters.
1 to 5.
Okay, imagine this is quite big now. Okay, What about what is the diameter of the vagina during baby delivery? 10 to 11 centimeters. So it means that the vagina wall is supposed to be really expandable. Okay, in histo, when you will study the vagina, you will study that here we have an elastic fiber system and a muscle system. In histo classes, they won't name the muscle. In anatomy classes, we are not able to see any muscle. In the beginning of the 20th century, the anatomists thought that there is a separated muscle. They called it, has a Latin name, musculus constrictor suni. Okay, the constrictor of the vagina. Actually, I don't want to say it exists or doesn't exist. There is a muscle around the whole of the vagina which can be contractible and narrowing the vagina wall. Improvement. Guys, I'm just telling you, girls, close your ears and everything else. Okay, you don't have to hear this. Try to look for some XXX movies from Thailand when they start to push out ping pong balls from their vagina and they just throw it as far as they can, and some of the girls are able to smoke with their vagina. Wow. Ugh. It was a shock when I saw this. Okay, but how could it be they contract the wall? Okay, and they push out things. Okay, I'm sorry, exists. Was it clear? No. But yeah, now it's burned in your head forever. Yeah. And you want to see it. Yeah, I know. I don't want to see it again. Okay, was it clear? Good. Now let's see what happens when the baby is passing through. Now the only border between the rectum and the vagina will be the central tendon there. Okay, that's what I said. If the mother is giving birth at home alone, what happens? Unfortunately, this tendon is not so strong. So the vagina can rupture into the rectum with the baby head. Okay? It's passing through everything. What is the problem with this?
The sphincter.
Sphincter?
It's weak.
Oh, it will be
Infection?
infection. Okay? Because through the rectum, the bacteria and all these things can go back to the vagina, and the vagina is not a problem if it's like that, because it has an acidic pH, so it will kill the bacteria. But it can go up to the cervix of the uterus, fallopian, even it can reach the ovaries. It's such a serious sepsis or infection that the doctor should remove the complete internal genitals. And now the mother forgot to give new birth. Okay, so that's why it's very dangerous. That's, of course, they sew it together and they won't have any problem, but the infection is the problem, not the torn part. Okay, now let's see the reality when the mother is giving birth in a hospital or not alone, together with the doctor at home. Okay, because here in Hungary, the system is low. But in Europe or everywhere else, if you want